Please welcome my first guest, Dr. Andy Smith, who's a general surgeon with Novant Health Surgical Associates here in Bolivia. Dr. Smith, thank you for coming today. I know how busy you are.
June, I'm happy to be here. How are you?
I'm well.
Good.
Thank you for asking.
Good.
So, we've been friends a long time. We've known each other a long time. So tell our viewers, how long have you been with Novant Health?
This is my 6th year with Novant Health. So I came in 2017, and it's been a great experience just to see how quickly things have been growing here, and the population's booming, and Brunswick County's growing all over. So it's been a really wonderful experience.
It's been a fun time to be part of Novant Health.
Absolutely.
Yeah, I know. So what made you want to be a general surgeon?
I think I liked the combination of being a complete physician, in general surgery. We take care of a lot of different body systems, a lot of different illnesses, a lot of different physiologies. But the surgical part of it was extremely appealing. I like working with my hands.
It's fun, isn't it?
It's fun. I like fixing things. I like that tangible nature. If something's broken, I can fix it.
That's awesome. I just love your the way you talk, the way you're so calm. I think patients and families probably really appreciate the way you come across.
Yeah, I think it's important, to be in control and in charge when things come up. We deal with some difficult situations, and being calm and patient are always helpful traits.
Yeah. So what are some of the most common surgeries that you perform?
So our group as a whole, we do a mix of things, and we all have some areas that we're, have a little niche in. But in general, I do a lot of colon surgery, gallbladder surgery, hernia surgery, breast surgery, thyroid surgery. So it's a pretty broad, general surgery practice.
You don't get bored. You have all these different.
We don't get bored.
That makes it much more interesting. So talk to me about hernia repair. So how common are hernias?
Hernias are very common. The most common type of hernia is an inguinal hernia, which is a hernia that forms in the groin. In general, the definition of a hernia is essentially a defect in the muscular wall of the abdomen. And so what happens is an opening occurs for whatever reason. Sometimes it's a congenital hernia or something related to an incision that a patient's had previous surgery from. But nonetheless, it's essentially a process where an opening occurs underneath the skin, and some intra-abdominal contents are pushing through this defect.
Yeah. Do both men and women get hernias?
Both men and women get hernias. A little more common in men, particularly with inguinal hernias, and inguinal hernias being the most common hernia. About 27% of men will experience an inguinal hernia in their lifetime.
Do they always have to be repaired? What happens if you don't repair them?
So, not necessarily. It just really depends case by case. So, somebody who is not active at all, has a very small hernia and has no symptoms from the hernia, we might watch that. We might determine it's safer to keep an eye on it than to fix it. Although hernia surgery is very, very safe, the majority of patients that we see with a hernia, we likely are going to recommend a surgical repair.
And I'm just going to ask you this question. It's not even here. You hear a lot of controversy about the mesh that they use during the repair. Is it common to use the mesh now, or do we not use mesh anymore?
So that's a great question. It comes up, very routinely when I'm talking to patients about hernia surgery. In general, for most hernias, again, not all hernias, but for most hernias, when we're talking about hernia mesh, the risk of recurrence, if we don't use a hernia mesh, which is just called a primary repair, the risk of recurrence of that hernia, it coming back, is very, very high, okay? If we put a piece of mesh in, it reinforces that repair and, generally speaking, reduces that risk of recurrence to a much lower number. To address your question, there were some meshes on the market in the past that were used sparingly. Right, that had some bad outcomes and some things like that. Those are not on the market anymore. I never personally use any of those meshes. And I think, it's a matter of your surgeon being in tune and being up to date on what's out there and being very selective in the types of mesh that we use. So the mesh that we use here is very safe, has a very, very safe profile, and has been around for years, and millions of patients with that mesh who have done extremely well with it.
That's really good information. Let's switch and talk about gallbladders for a while.
Sure.
So what causes the gallbladder attack to be so painful? What is that?
Right. So there's a couple different types of gallbladder attacks that people can have. Sometimes it's related to gallstones that form in the gallbladder. Sometimes it's just related to the gallbladder not emptying properly. The gallbladder is a little sac up under your liver that's attached to the bile duct that is secreting bile from your liver. Your liver makes bile and secretes it into your intestines to help with digestion of certain things. The gallbladder, like I mentioned, is this little extra reservoir for bile. And so when you eat a certain type of food, usually something greasy or with a lot of fat content, fried food, I tell patients anything that tastes good.
Spit it out.
The gallbladder is a little muscular sac. It will squeeze and give you a little extra boost of bile. And so if the gallbladder is not emptying properly, if it's a little twisted or there's some narrowing there, that can cause some pain when it's pushing against pressure. The other reason is with gallstones, they can get in the way of the gallbladder emptying properly and they can cause pain.
Speaking of gallstones, what causes a gallstone to form? What is that stuff?
Sure. Well, bile's made up of several things, bile salts and cholesterol being the main components. And usually it's a too much or too little of one of those things. And so what happens, just like with salt in water, it can crystallize. Bile salts and cholesterol can essentially crystallize and form small stones that get bigger over time and they become gallstones.
Well, I know that some people end up in the emergency department for gallstones or gallbladder related pain. So would there be symptoms prior to that point that might alert them that there's a problem, and then do something before they end up in the emergency room? Sure.
So the most common symptoms we see with gallstones are what we call biliary colic. Those are those general symptoms from gallbladder disease. People can have right upper quadrant pain. Again, we mentioned the gallbladder is up on the right side under the liver. So right upper quadrant pain. Typically, it's pain that comes on after eating. Oftentimes, some of those foods that I mentioned. And usually, it's self-limited. It'll resolve within a few hours. Sometimes it doesn't. A lot of people end up in the emergency room. It can cause some chest pain, epigastric pain.
Oh yeah, you think you're having a heart attack.
Correct. Yeah. So it's important if you're having those symptoms to come in. Let us check you out and make sure we know what's going on and rule out something like a cardiac issue.
Right. Yeah. Well, we're running short of time, so I did want to touch on minimally invasive procedures.
Sure.
So tell me how your group, does your group perform those types of procedures?
We do.
And what kind of procedures would we?
So we're fortunate we have, and for several years have had the Da Vinci robot surgical system here. So a lot of those colon surgeries and hernia surgeries that we talked about, and gallbladder surgeries as well, are done with the Da Vinci robot. And the benefit of that is small incisions. So numerous, or most of the time, it's 4 or 5 small incisions with the robot. And we're able to do the whole operation that we used to do through a larger incision with the robot. So the results are less pain, faster recovery, out of the hospital sooner. So a lot of benefit to the robot and that minimally invasive technique.
Yeah, I have seen patients get out of the hospital that very day.
Absolutely.
It depends on the patient and the procedure. But
sure. Yeah, it's been amazing to see, patients that used to stay in the hospital 3 or 4 days after a certain type of operation may go home the next day. And that's just amazing and good for the patient and everyone involved.
Yeah. Well, Andy, thank you so much for being here today. It's such a pleasure to have you. I know how busy you are, and I know you have to get right back to surgery. So thanks again for being here, and I look forward to having you back.
You're quite welcome, June, anytime.